Sorry about that, I accidentally hit the stop button. So, where I left off, I think I was saying this is the, you can also see the vomer. It's the very bottom part of this bone in the middle of this nasal cavity right here. It's the very bottom part of it. And you almost can't even see it on the model I have at my house here, but it's right there. And then this top part, sorry, it's my dogs. The top part right here, this is the perpendicular plate. So it's kind of hard to distinguish the two maybe on this video, but when you get in and start messing with them in your hands, it'll be easier. Let's see. I think that's about all that I'm going to go over on the outside here. On the side right here, where it looks like your ear would go, that is the external auditory meatus. There's an internal one, if you can imagine. I'm going to take off the top of this skull here. Maybe. There we go. Alright, and so now we have the inside of the skull. So up top right here, this is going to be, you know, the frontal bone, and the front of the face is over here. This is the occipital bone right here, foramen magnum, to just kind of get you oriented to the locations. I'm going to zoom in right here, and, well, you can see frontal bone, and I'm zooming into this right here. Alright, good deal. This little plate right in there, it kind of looks like they're little itty-bitty holes. I've tried to use some ink to show them on there. That is called the cribriform plate. This right here, in the middle of it, that is the crista galli. And zooming back out, and now we're going to zoom into this part right here. Come into that. That is the sella turcica. I think sella turcica means saddle in like Latin or Greek or one of those languages. Right there. But right here, this little depression in there, that's where the pituitary actually sits when your brain, you know, is inserted inside the skull here. But this right here is the sella turcica. It is just anterior of the crista galli and cribriform plate. On the crista galli right here, I've heard people say, I have, you know, a baby named Krista, and I put her in her crib and feed her a plate to eat or something like that. You know, anything you can kind of do to sum all this together, the better. And I've, you know, on a personal basis, for me, I know the goofier the phrase I can come up with, the better it is. I can remember it, or the dirtier. You know, generally the better the retention you'll have on it. So zooming out again. All right, now we're going to come in on this right here. And I'm going to kind of tilt this up just a little bit. Actually, let me grab, see if I can't have it sit up on the, there we go. All right, this top part right here, this is the greater wings of the sphenoid bone, right in here. This part down in here, right in there, that is the lesser wings of the sphenoid bone. There's a right and a left, so right wing, right greater, left lesser, or right lesser, left lesser. So I think that's about, there's some foramens and stuff that we'll go over in class, but for right now, that's about all I want you to focus on inside the skull. And let me give it a once over here, make sure I don't forget anything that is general I want you to go over. Nope, that's probably it. If I forgot anything, we'll go over it more in class. But that should give you a general baseline knowledge starting for next week. All right, hope that helps. Thanks for watching.